Good afternoon, my name is Ethna Keegan, and this is my oral presentation on the strategic plan of St. Joseph's Health Mission Hospital, which intends to improve the quality of healthcare provision. In particular, the hospital will partner with institutions of higher learning and other healthcare providers. From these partnerships, the hospital is expected to benefit from quality personnel and research and development programs. The outcome of the partnerships will be determined through common metrics such as the decline in infection control, reduction of medical errors, readmissions, and the length of stay. It will include the goals and strategies to improve the levels of healthcare delivery and customer service, the SWOT analysis, the stakeholders analysis, an action plan, and questions. The goals and strategies. The goals are to improve the quality of care and subsequent patient outcomes. It will do this through partnership with universities and research and development, participate in employee exchange programs with other hospitals, tap top talent from universities and colleges, replace executive management with better experienced and skilled personnel, improve staffing and nurses, especially in the ambulatory units, train new surgeons. To reduce the operational costs and increase revenues, it will outsource experienced personnel from other hospitals, conduct research on prevalence of different health conditions to ensure that the hospital meets the demand for an excellent healthcare center, and then offer free medical services such as cancer screening on a specific day of the year to retain customers and attract new ones. The strategy plan is a 4-part strategy map. It will include the financial perspective, the customer perspective, the internal perspective, and the learning and growth perspective. The financial perspective will include the provision of a wider range of services, enhance medical resource use, increase the revenues of the hospital. The customer perspective, we will enhance patient care, provide high-quality services to patients, and provide innovative services to cancer patients. The internal perspective, we will enhance relationships with sponsors, partners and volunteers, enhance quality and flexibility and reduce costs through processes, and provide a wide range of products through innovation and venture into new areas. For the learning and growth perspective, the volunteers and new employees will have ongoing training, enhance information sharing by partnering with other healthcare providers, such as Monarch and Anthem Blue Cross, continue with the hospital's culture of innovation and quality provision. The SWOT analysis. Our strengths are that it is a full-service hospital and medical center in Orange County, California. It provides advanced diagnostic care for neurostroke service and oncology. It leads the way in advanced diagnostic care. It is recognized for excellence in perioperative nursing care. Further, it has a CNOR recognition from the Competency and Credentialing Institute for this same area. The hospital has a Magna status, which is recognized by the American Nursing Credentialing Center for Nursing Excellence, and it is a baby-friendly USA designated hospital. Its weaknesses are its incompetent management in specific areas of the hospital. It's outperformed by UCI Medical Center in ear, nose, throat, geriatrics, and nephrology, and UCI has a level 1 trauma hospital. We are a level 2. We do not provide burn services. Poor service care provision leading to infections. This is an area that can be improved. It is improved in quality of care to avoid hospital infections. And in the area of executive management, it can be improved by hiring better management. The opportunities Mission Hospital has is that it is in Orange County, which has a very high population and guarantees adequate clients for the facility. It has an opportunity to provide higher level of trauma services. It is one of the best level 2 trauma centers in Orange County, and simply because the trauma personnel are completely committed to trauma care, unlike many other hospitals that charge their trauma personnel with ER responsibilities besides trauma care. The threats to Mission Hospital are customers' decline due to poor publicity relating to infections in our OR and the closure of our OR for 1 week. This received negative publicity. The recent news feature that was reported widely by various news media about the closure of operating rooms in the hospital after 4 of its patients acquired infections after operations. Unfortunately, despite the small number of patients being infected, the incidence was enough to attract the attention of key accrediting agencies. Such events would likely scare away clients, its competition due to lack of trust and fear that the hospital may not be able to keep up with the stringent infection control policies. Competition from UCI Medical Center, lack of adequate financial support for specific areas such as the OR, and lack of adequate funds allocated to the trauma center. The stakeholders analysis. Most important stakeholders are the patients. Most interested and with more power are the sponsors and partners. Most interested but with low power stakeholders are the volunteers, and less interested and with little power are the community. The action plan will partner with universities and medical colleges to collaborate in medical research and development, absorb talented students through internships, strict adherence to infection control protocols, and reinstate trust with the community we serve. We will partner with other medical service providers in the community to benefit from outsourcing, to engage in employee exchange programs, and to engage in the on-the-job training programs. The action plan, implementation tactics, align goals with the responsibilities, rely on teamwork, integrate both new and current employees, managerial decision-making methods, point counter, devil's advocate, human resource management strategy, and avoidance of groupthink. Better teamwork, more empowerment, and integration of new and current employees is necessary. During the implementation of the action plan, we will apply managerial decision-making methods such as point counter and devil's advocate through the engagement in rigorous debate and advance of groupthink. On groupthink, we can avoid the tendency of people to think in groups as a way of suppressing contrary opinions, since in such situations, the desire for harmony overshadows the decision's quality. A human resource management strategy entails getting the right individuals on board to improve quality patient service and innovation to enhance its service provision to their patients. Leadership strategies, delegation, performance improvement. Performance improvement strategies compare hospital data with others to identify the weak points in our hospital and designing of new services that can detect problems. Communication plan will be through group gatekeeper, report content release, specific forums, and inside messenger. St. Joseph Mission Hospital communication plan will use a gatekeeper strategy, particularly in universities and colleges, to identify potential interns and workers that they can absorb into their system. The hospital will rely on report content release strategy and in particular structured teams and human resources meetings. In this strategy, a team of specialists will provide regular reports and updates on the progress of students, internship and workers on the job training, absorption as well as employees on the exchange program. Furthermore, structured teams and specific forums will provide information about the progress of research and development carried out by the institution of higher learning in conjunction with the hospital. Specifically, the communication about research and development programs progress will be done using specific forums such as research and development strategic committees. Lastly, Inside Messengers will provide information about individual talents of students in universities and colleges. Mainly, the Inside Messengers will include professors and administration. Informal communication is useful in gatekeeper strategies and messenger strategies. Formal communication is useful in specific forums, report content, release strategies. The communication plan addresses strategic plans through improvement of our service provision through timely replies and warnings, enhance innovation through information dissemination, and enhance commitment and involvement of human resource management. Leadership managerial skills, accountability, promote relationships, and embrace motivations. A good leader manager should always motivate workers so that they can overcome numerous work-related challenges or even boredom from performing repetitive tasks. In this regard, the leaders and managers at St. Joseph's Mission Hospital needs to enhance communication through active listening, confirming what they say through paraphrasing, face-to-face communication, as opposed to reliance on emails. This should also enable employees to access relevant documents through file sharing software. It is important that mutual trust and dialogue are promoted through effective communication channels. For instance, they should have live meetings, coffee breaks, care calls, and team member social media platforms in order that the sharing of ideas, opinions, and grievances can be promoted. When it comes to creating a sense of accountability, leaders should promote autonomy and empowerment, developing result-based metrics and by sharing action plans with teams. Furthermore, managers and leaders need to embrace constant monitoring of the action plan. The latter will allow for prompt intervention as needed in order to increase the chances of attaining the final targets. Evaluation. It will partnership with universities and colleges, the effectiveness of the research and development in improving service provision, competence of student interns in executing their duties. It will also partnership with other healthcare providers. The competence of the acquired personnel in executing their duties will be evaluated, and the feasibility of the program in terms of cutting costs will be done. The metrics used will be infections, medical errors, hospital readmissions, the length of stay, and rate of disease reoccurrence. Questions that could be asked in this situation are: why did Mission Hospital have their OR closed? And what caused the infections in the OR? 4 of its patients acquired infections after surgery. Unfortunately, despite the small number of patients being infected, the incidence was enough to attract the attention of key accrediting agencies. It was determined that the cause of the infections were due to high humidity controls in the OR, and required monitoring was not in place. Why was management not on top of this problem? This is where the CFO was made the CEO, despite having limited practical experience in management, which was shown in this regard in the OR. Unfortunately, he dismissed all the leaders with genuine management, hospital and clinical experience, and gave the oversight of the OR to a non-medical person. This concludes my presentation. Thank you.